Every year, hundreds of Americans struggling with addiction travel to a clinic in Mexico, hoping a powerful psychedelic drug can finally break their cycle because that drug is illegal in the United States, and the Trump administration says it wants to change that. President Trump has signed an executive order fast-tracking Ibogaine for addiction treatment research and FDA approval. But the drug remains a DEA Schedule I controlled substance with no FDA approval, and experts warn of cardiac risks linked to potentially fatal heart complications. One clinic in Mexico alone reports treating nearly 3,000 patients over the past decade. These are Americans who cannot access Ibogaine legally on U.S. soil. They undergo medical screening and monitored detox before receiving the psychedelic in a controlled clinical setting, with staff tracking vital signs throughout. Clinics like this one operate openly in Mexico, where Ibogaine is legal and regulated. The clinic owner, a former addict, told Sky News the treatment is intensive. Patients are medically screened beforehand and monitored throughout the session for any complications. Podcast host Joe Rogan has been among the most vocal advocates, claiming an 80 to 90% success rate for addiction treatment. His platform has helped push Ibogaine into mainstream political conversation, influencing policymakers and patients alike. That gap between what patients are seeking and what U.S. law allows is enormous. And while Mexican clinics operate with medical oversight, the American black market for Ibogaine is completely unregulated, adding yet another layer of danger. Medical experts are sounding the alarm. Ibogaine has been linked to cardiac risks, including potentially fatal heart complications. Without FDA-approved clinical trials in the United States, the drug's long-term safety profile remains poorly understood. Republican psychedelic advocate Brian Horde acknowledges the tension. He says the administration is racing to deliver on a promise of breakthrough treatments, but the science has not yet caught up to the politics. For patients desperate for help, the question is whether fast-tracking a drug with known cardiac risks is worth the gamble.